Hi, I'm Dr. Kristie Clark, and I've been a medical doctor for over 20 years, mostly in rural medicine. My father's a disabled veteran. I grew up in a military home where we moved around a lot. My mom had many different jobs growing up because every time we moved, she really had to start over, and it was stressful. My husband's also a doctor, and we've practiced rural medicine together for over 16 years. Mostly in rural Kansas. And we did everything: hospital, clinic, nursing home, emergency department. Both of us actually have quite a bit of emergency department background. I worked in emergency department in Fort Worth while my husband was in training. And even though we had all these different jobs in rural medicine and we were the only doctors in our county, when we looked at our actual practice, about a third of our patients were coming to see us for mental health disorders. And some of them were driving over 2 hours to see us. And when we look at rural America, particularly rural Kansas, it's a desert for mental health care. And we didn't have any therapists to refer to. And we had community mental health centers in very large population areas, but patients would often have to drive an hour or 2 hours to these centers. Unfortunately, especially in rural areas and conservative areas, there's still too much stigma with mental health issues. And so oftentimes people wouldn't want to drive. They would feel comfortable coming to the rural health clinic. So they would come and see Dr. Robert Clark and myself, and we would do the best we could with few resources. We didn't have therapists. We love therapists and think that everybody needs a therapist. They make us better problem solvers and help us with coping skills, but we didn't have therapists in the rural area. And the tools we had were medications and just our own listening to people and providing support. And even though we were very early adopters of the genetic testing for medication metabolism, which helps us try to find the best medication for a patient, even then, sometimes 2/3 of the time, a medication would fail patients. And we'd try another medicine, and that might fail. And we knew from the studies that after 2 medicines, there's very little chance that with a 3rd or 4th medicine that we'll find a medicine that works. This was very difficult for us to face the fact that as physicians, despite all our schooling, all our experience, we had few tools. And we started really looking at other options for treating patients. It became very obvious to us during the pandemic because there was so much stress and mental health just became so obvious that we needed to work on that for all of us. Depression affects 1 in 5 people at some time in their life, 20%, 1 in 5, maybe more. These are the people who are brave that go and seek help. And we look at suicide. Suicide is when we lose the battle to depression. It's a top 10 cause of death in the United States in people aged 5 to 64, a top 10 cause of death. And the rates have been increasing, which tells us whatever we're doing is not working. So during the pandemic, I had my own health struggles that weren't related to COVID at all and had multiple surgeries and near-death experiences and realized I really needed a social worker. I needed a therapist. I was on so many medicines. I was seeing so many specialists. My doctors were sending me to the Mayo for second opinions that I needed somebody to help me figure out coping mechanisms and help me negotiate what was going on. And it seemed really important that this person be a therapist. So somebody that wasn't related to me, that wasn't a friend, because everybody had so much stress that it seemed like my stress and what was going on with me was just creating more stress for my family and friends. So I needed somebody very, very objective that I could talk to. And I found therapy very important and maybe even life-saving to have someone to talk to. Make sure I saw my doctors, I was organizing all my meds, I was doing everything I needed. And around that time, my husband, who's my doctor partner, we were really trying to figure out what are we going to do next, realizing that maybe we couldn't do the whole ER hospital clinic schedule forever, because for years and years and years we'd been on call nights, weekends, holidays. And we were thinking about giving up the mental health care piece of our practice, because it was about a third of our practice, took a lot of time. We didn't know if we were doing a good job there because our tool was a medicine. And we felt like the tools of medicine, particularly for depression and anxiety, fail people so much of the time. And then we had this really change of heart. And I think it had a lot to do with our own backgrounds and the health issues I was experiencing. And we realized that we needed, as doctors, to really go out there and do our due diligence to see if there was something better for our patients other than just medications. And we knew therapy was key to it, but are there any other treatments that might work? And we've been hearing about TMS and SPRAVATO and ketamine, and we knew there was studies being done on psychedelics. And so we started researching and realized that TMS had been FDA approved since 2008. SPRAVATO, which is S-ketamine nasal spray, had been FDA approved since 2019. That's 4 years ago. We started wondering, why aren't doctors talking about this? We know we're in a mental health care crisis. Why aren't we using the tools? And then we realized those tools require a lot of training, a lot of organization, certifications. And so my husband, Dr. Robert Clark, he went to Duke and did a visiting fellowship in TMS. And then he went out to California to Del Mar and worked with Dr. Burlow, who was one of the first psychiatrists to start doing TMS, and he shadowed him. And then I did the research to find out what it took to get a SPRAVATO REMS certification, because it's not a medicine that any pharmacy can dispense. It's not a medicine that can be dispensed to patients, and it has to be given in a healthcare setting with monitoring for 2 hours, because patients can have side effects. The main thing we watch for is high blood pressure. And it's very important that when patients receive these medicines that they're in a safe environment. And so both the other Dr. Clark and myself, we did our due diligence to find new tools for our patients. And next we had to decide, well, where are we going to implement these tools? And because we both grew up in military families, we felt very attracted to Junction City. It was a bigger population, so it had more opportunities for our teenage sons, more restaurants for us to go to, closer to many other large towns, but at the same time feels very rural. And we've been so happy with our decision because it's felt like home. People have been so nice to us, they've been so helpful. And culturally for us, having grown up in military families, Junction just feels very comfortable, but at the same time feels very rural. And so we've really thrived here. Our clinic opened in January of 2023. We started seeing our first patients in February, and by April we're full. And we feel like we're full because the need's great. And the services aren't available other places nearby. And so a patient would have to go to Lawrence or Kansas City or Wichita to find another practice that provides 2 options for treatment-resistant depression, which are SPRAVATO and TMS. And they're very different treatments. We have a very few patients that are doing both. And typically the patients that are doing both are patients that perhaps either they've tried SPRAVATO or tried TMS and haven't gotten better or have relapsed. And to us, it's pretty obvious. And a lot of the research coming out of Stanford is showing that the 2 treatments together are probably superior and may have as close as 90% efficacy for remission from depression. Most patients, though, they're either receiving SPRAVATO or TMS, because depending on the patient, one might be better than another. Plus, depending on their medical conditions, there might be one of the treatments that isn't best for them and the other one is. So how do they work? SPRAVATO is basically S-ketamine. So if you remember back from chemistry, asymmetric molecules have a left and a right-handed isomer, and all S-ketamine is the left-handed isomer of ketamine. And it's made by Janssen. It's FDA approved for treatment-resistant depression, where someone has tried 2 or more medications from 2 different classes, as well as therapy, but have not had their depression adequately treated. It's a nasal spray that the patient self-administers in our clinic under observation, and we monitor blood pressure while the patients are here. Now, how does it work? It's interesting because we're not really sure. We know that it works. For decades, ketamine has been used for sedation. When I've worked in the emergency department, we would give kids ketamine to set broken arms. And we've known for a very long time that it has dramatic effects on mood. And in the psychiatry world, ketamine has been given off-label IV for really severe cases of depression and other mental health disorders. So we know it works, it's FDA approved, but how does it work? What I see in my patients that I care for is that we know ketamine has pain relief. We know it has a dissociative effect. It seems like, from what I see and from what I'm told by people who experience it, is that it gives them perspective on issues they need to work through. And suddenly, everything that they maybe knew could be a coping mechanism for them, or things that their therapist has talked to them about, kind of clicks and makes sense, and they're able to start negotiating and working through issues. The other interesting thing about ketamine is we know it sits on pain receptors, and it seems to sit on pain that is from trauma as well, emotional pain. And while people are undergoing a SPRAVATO treatment, very interestingly, they will sometimes open up about past trauma. They will relive past trauma as a flashback. They may remember a dream or a smell or something that triggers a memory. And what people have shared with me in confidence, I find is, probably one of the greatest privileges of my life. One of the most fun things I've done as a doctor is deliver babies, healthy babies to healthy mamas. And being in a SPRAVATO treatment with a patient is much like that, because you realize you're delivering somebody from this trauma. Life is difficult for all of us, and it's just a beautiful thing. And it can be painful, just like childbirth and the labor of childbirth, but then you have this beautiful new baby. And that's what it feels like when we're treating patients with SPRAVATO. As for TMS, TMS works very differently. And it's actually a very powerful magnet. We have the MagVenture system from Denmark, and it's a figure 8 coil. And so we can get very specific in the location of the brain that we treat with TMS. And the magnet is very powerful. It's 2.5 Teslas, whereas an MRI is 3 Teslas. So it's a little loud. You have to wear earplugs. Again, it's not the right treatment for everybody, but when it is, it can be very powerful for remission from depression. And I find that when we map patients' brains, just the brain mapping alone is very destigmatizing for their mental health disorder, because when we map the brain and we can point and say, okay, this is the F3 spot, which is about here on most of us, and that's what we're going to stimulate during your TMS treatment, and that's going to help treat your depression. People's eyes light up because they realize, you mean it's not me, it's not my fault that I'm depressed, I'm worthy of getting better? And you're like, yes, your depression's here. It's a brain disease, just like somebody might have a heart disease and have a clogged artery and need a stent. It's not much different. We just need to stimulate that part of your brain. We're going to treat your depression. And that alone is very comforting for people going into TMS. Anxiety, interestingly enough, is very symmetric here from the depression. It's on the right side. And that also is very validating to people when they're undergoing bilateral TMS for anxious depression, and you're going to treat their anxiety, and they realize it's a spot that needs inhibition to calm down. That alone is very helpful. What's interesting when we compare and contrast SPRAVATO and TMS is that SPRAVATO seems to start working faster. TMS takes a little longer to start working. Usually with TMS, patients, because their brain is doing so much rewiring, get super exhausted 2 or 3 weeks into it. And things start seeming worse before they get better, but if they hang in there around the 3-4 week mark, they really start feeling better. There's some slight difference in the statistics. If you get better, it really doesn't matter what these statistics are. But for SPRAVATO, a lot of times patients take a little longer to go into remission, even though they start feeling better faster. So they have to go on to maintenance weekly treatments for a while. Whereas with TMS, once we run through, depending on what protocol they're on, it's usually about 9 weeks. Once we run through that protocol, usually at that point they're in remission and they're done, although they may need maintenance sometime in the future. What I really want anyone who's thinking about seeking us out for their services to know is that we highly recommend that all our patients continue in therapy. If you come to us and you don't have a therapist, we'll do our best to try to help you find somebody that you can establish that therapeutic relationship with. A lot of our referrals do come from therapists, and we appreciate those referrals very much. The therapists oftentimes seem to be the ones that know when patients aren't doing well and maybe have tried 2 or more medicines and they just don't seem to be working. Therapists are very good listeners. And what I would say to any therapist thinking about sending us a patient is that all you have to do is know that the medications aren't working, and then either reach out to us or have your client reach out to us to make an appointment, and we'll take it from there. We'll help sort out which treatment might be best for them. If it looks like they're not quite ready for SPRAVATO or TMS, we can always do the testing for genetic medication metabolism. We use the GeneSight to see which medicine might be right for them. What I would say to doctors, because this is not in our curriculum yet, if you haven't heard of SPRAVATO or TMS, it's not your fault. It wasn't very long ago. We were there too. And this is an area that's emerging. It's still very new. It's something any of us can learn about, even if we don't want to incorporate it into our practice. I think it's very important that as doctors, all of us, primary care included, know what these treatments are. And so that when we do have a patient who has tried 2 or more medications for depression and the medications aren't working, because we know most of the time they don't work, then you've already identified a therapy that you might be able to refer your patient to. And what I'd say to the doctors is, again, you don't have to know whether or not SPRAVATO or TMS or both is the best treatment for your patient. You don't have to do the prior authorization. All you have to do is do the referral. We'll do a very thorough intake, and we will do a very thorough medical consult to help your patient determine which is best for you, or for the patient. If you're listening to this and you think that perhaps Victory Clinic has services that might benefit you, and you're interested in genetic testing or SPRAVATO or TMS, you don't have to wait for a referral. Dr. Robert Clark and I are both medical doctors, and patients can come see us directly. You can self-refer yourself. Just pick up a phone and call us at 785-209-3779. Or you can go on to our website, which is victoryclinics.com. So it's victory spelled out, then clinics.com. And you don't have to call us. A lot of times we realize when we're depressed and not feeling well, sometimes we don't want to talk on the phone. We also have a texting number on our website. You can text us directly. It'll probably be me texting you back, or you can email us if you want. And all of the ways of communicating with us are private and HIPAA compliant, but reach out, ask for help. We're there for you. That's why we're here, is we're here to serve you. And so if you feel like you could benefit from any of these services, you don't have to wait for a referral. Just reach out to us directly. And if you do have an insurance that requires a referral, like TRICARE West or VA. They love their referrals. Again, we grew up in military families. We understand these barriers. We have negotiated ways around them. Just reach out, come see us, and we'll help you get it figured out. You might be watching this and you have a loved one who's suffering from depression or anxiety, and you just want more information. You can visit our website at victoryclinics.com, and that's Victory Clinics with an S. And there's a lot of information there on TMS as well as SPRAVATO. The website is really built for education. There's testimonials there. There's also links to our Facebook page and our Instagram. And if you go to our Facebook page, you can find more links to things like the PBS show that Dr. Robert Clark and I did together on SPRAVATO and TMS. And you can find other educational things that we've worked on. There's hope for depression, and you're not alone. And if it's a loved one or yourself suffering, there's treatments out there when medications have failed you. The people that we care for at Victory Clinic are some of the bravest, most resilient people I've come across. They're the people who sometimes have tried 20 or 30 medications for depression, years of therapy, have had hospitalizations for suicide ideation and suicide attempts, yet they keep going. They keep living life, and they know that life is worth living, and they keep seeking out something that will work. They're brave, they're resilient. If you're watching this and you need to ask for help, please ask for help. You're brave, you're resilient, and there's hope.